From smelling and tasting urine to diagnose patients, to manually widening a woman's pelvis to allow for childbirth, we look through 10 horrible medical procedures you won't believe existed. Number 10. Urine Therapy. In medieval Europe, doctors would closely analyze urine, smelling and even tasting it, to diagnose their patients. It's one thing to use the liquid as a diagnostic tool, but another to bathe, slather, or drink it as a cure for what ails you. Yet many before us, from the ancient Chinese to Egyptians and Indians, would drink or apply urine to the body to prevent illness, beautify the skin, clean wounds, and cure cancer and other illnesses like strep throat. Number 9. Electroconvulsive Therapy. Electroconvulsive therapy, ECT, or electroshock, is a well-established, although controversial, psychiatric treatment in which seizures are electrically induced in anesthetized patients for therapeutic effect. Today, ECT is most often used as treatment for severe or major depression, which has not responded to other treatment. It was first introduced in the 1930s and gained widespread use as a form of treatment in the 1940s and 1950s. Eventually, it fell out of use in the medical community due to minor side effects like confusion, muscle aches, bone fractures, and memory loss that can last for months. Number 8. Lobotomy. The lobotomy was pioneered in 1936 by Portuguese neurologist Egas Moniz, who operated on people with severe psychiatric illnesses, particularly agitation and depression. Through holes drilled in the skull, Moniz cut through nerve fibers connecting the brain's frontal lobe, which controls thinking, along with other brain regions. Believing that as new nerve connections formed, the patient's abnormal behavior would end. It wasn't until the 1950s that the lobotomy was phased out in favor of drugs and medication. Number 7. Maggot Therapy for dead tissue. Maggot debridement, also known as maggot therapy, has been used off and on for most of human history, especially during times of war. Debridement is the removal of dead tissue, like you would get in an opened wound. So, as you can imagine, maggot debridement is a way of removing dead tissue by putting live maggots into the wound. While it would make sense for modern medicine to have moved past something as seemingly barbaric as dumping maggots into an open wound, it's actually picking up steam again in the medical community, so much so that it's now covered by some insurance plans. Number 6. Intestinal parasites for allergies. Although it's not a mainstream treatment just yet, there are plenty of doctors who have taken up the age-old claim that hookworms, an intestinal parasite, are an effective treatment for allergies. Since the 1970s, researchers have noticed a strange connection. Countries with high instances of hookworm infections have pretty much no allergies or autoimmune diseases. Scientists are now studying why that happens, and they're doing it in the only possible way that makes no sense: by infecting people with parasites. Number 5. Trepanation. Humanity's oldest form of surgery is also one of its most gruesome. As far back as 7,000 years ago, civilizations around the world engaged in trepanation, the practice of boring holes in the skull as a means of curing illnesses. Researchers can only speculate on how or why this grisly form of brain surgery first developed. A common theory holds that it may have been some form of tribal ritual or even a method for releasing evil spirits believed to possess the sick and mentally ill. Still, others argue that it was a more conventional surgery used to treat epilepsy, headaches, abscesses, and blood clots. Number 4. Leech Therapy. What happens when you cross bloodletting and maggot therapy? You get blood-sucking leech therapy. Of course, the leeches aren't used for everything, including headaches and ear infections like they were in medieval times. Instead, they are used to help drain blood from swollen parts of the body after reconstructive surgery. Doctors find they are particularly helpful when the areas contain many blood vessels that can easily clot up. Number 3. Transsphenoidal surgery. Transsphenoidal surgery is a minimally invasive procedure where surgeons access the brain through the nose to remove tumors. According to Raj Sindwani, an otolaryngologist with Cleveland Clinic, the practice has been done for thousands of years, with the ancient Egyptians having discovered that the easiest access point to the brain was through the nose. Number 2. Symphysiotomy. Symphysiotomy is a procedure by which the pelvis of a pregnant woman is manually widened to allow for childbirth. In places without medical equipment, saws were used to cut it wide enough for the child to pass through comfortably. That might sound like something from medieval history, but the procedure was widely used by Irish doctors between the 1940s and 1980s. The women were often not told in advance what the doctors intended to do, and the consequences were often horrendous. The victims weren't able to walk, and they usually developed infections and back problems. Basically, all the things you'd expect from having your body cut up with a saw. Number 1. Tooth and eye surgery. Osteoodontokeratoprosthesis is a procedure for blind patients with damaged eye tissue. It involves pulling one of your teeth out and implanting it in your damaged eye. And it works. The transplant is based on the idea that once the body senses a tooth, instead of, say, a mechanical implant, the body won't reject it. A part of the jawbone is surgically separated for the process. Then they drill a hole through the tooth to hold a prosthetic lens. Once the transplant is successful and it's been accepted as part of the body, the doctors can replace the tooth with an artificial hold. The doctors who did perform this surgery have had a fair rate of success, and it might just be fairly common in the future.